Bismillahirrahmanirrahim. Assalamu alaikum. A 4-year-old boy is evaluated in the nursery for routine newborn care. The patient was born at 38-week gestation via spontaneous vaginal delivery to an 18-year-old woman who did not receive prenatal care or take prenatal vitamin. Birth weight is 3.6 kg. Vitals are normal. The examination shows a sleeping infant is in no distress. There is molding of the occiput, a soft mass inferior to umbilical stump and is 1.4 centimeter in diameter and covered by skin. The mass increases in size when the infant cries and reduces into abdominal cavity with genital pressure. The mass does not seem to be tender to palpation. The rest of the examination is normal. Which of the following is the best next step in management of this patient? So this patient is a 4-year-old boy having a soft mass inferior to umbilical stump, which is 1.4 centimeter in diameter and which is covered by skin. The mass increases in size when the infant cries and reduces into abdominal cavity with genital pressure. The mass is non-tender to palpation and the infant seems comfortable. So first of all, the diagnosis of this question is congenital. Diagnosis of this question is congenital umbilical hernia, and for the management of congenital umbilical hernia under age 5 is just observation. It will resolve spontaneously. So here, this patient having congenital umbilical hernia, the pathophysiology include incomplete closure of the abdominal muscle, and clinical feature include soft, non-tender bulge at umbilicus that protrude with increased abdominal pressure and typically reducible. Management usually involve observation for spontaneous closure around age 5 of age. After age 5, if it persists, then elective surgery is required. So here the correct option is choice D. Come to the incorrect one, abdominal ultrasound. So abdominal ultrasound is for the is required when a patient having suspected hernia. This patient having congenital hernia. Choice B, immediate surgery. So immediate surgery is for the gastroschisis, which is an intestinal protrusion lateral to umbilicus, and amphilocele, which is a cover protrusion of abdominal content. Choice C, karyotypic analysis. So karyotypic analysis is for the patient having Down syndrome. The picture of the Down syndrome, for example, single palmar crease, hypotonia, sandal gap deformity, upslanting, palpebral fissure, epicanthal fold. This patient doesn't having these symptoms, so doesn't need to do karyotypic analysis. Choice E, topical silver nitrate. So an umbilical granuloma present in newborn after the umbilical cord has separated, and a moist red pedunculated febrile umbilical mass. So the treatment for this umbilical granuloma is silver nitrate. So this patient doesn't having umbilical granuloma. So here the correct option is choice D, observation only, because this infant age is 4 years, and until the 5 year the umbilical hernia resolves spontaneously. Thank you.